Today I'm going to be talking about the gastrointestinal issues that we see in people living with EDS and HSD. I'm Dr. Clair Francomano, and I'm a medical geneticist who has been caring for people with the Ehlers-Danlos syndromes and hypermobility spectrum disorders for many, many years. I'm going to give you some information about a retrospective review that we did of 100 patients that I saw in my clinic at Indiana University between January and June of 2024. This is work that was done by Ada Port, who is a third-year medical student at Indiana University, and Dr. Jen Glazer, a research nurse at IU. Ada and Jen looked at the records from 100 patients seen in my clinic between January and June of 2024, and they found that gastrointestinal problems are very, very common among people living with HEDS and HSD. 97% of the people, so 97 out of those 100 people, reported that they had some gastrointestinal complaints. The most common complaints were nausea, which was seen in 73% of the people, abdominal pain, also in 73% of the people, constipation was seen in 71% of patients. Gastroparesis, or slowing of the motility of the stomach, was seen in 19% of the people who were evaluated during that time between January and June of 2024. And typically, this is about 1 to 4% of the population have gastroparesis. So 19% is a very large number of people with slowed gastric motility. We also looked at the prevalence of vascular compression syndromes, things like median arcuate ligament syndrome or MALS, and superior mesenteric artery syndrome and the nutcracker syndrome. And 3% of the people who were seen during that time had one of these vascular compression syndromes. In the general population, this prevalence is about 1% or less. So again, this is a very high number of people to be reporting these vascular compression syndromes. And finally, there's a phenomenon called Visceroptosis, which means that the connective tissue holding the organs in place in the abdominal cavity is not doing its job. The connective tissue is too lax, and the organs are literally falling down into the lower abdominal cavity or the pelvis. And we can see this with the liver, which may, instead of sitting up in the upper right corner of the abdominal cavity, fall down into the mid cavity or below. We can see the transverse colon fall down into the pelvic area. The spleen may not be in the right place. The stomach may not be in the right place. And this change in the anatomy can cause really dramatic changes in the ability of the organs to function. So it's important to remember that this is a potential cause of abdominal pain and GI dysfunction in people with EDS and HSD. Now, there are also a number of non-gastrointestinal comorbidities that we see in people with EDS and HSD that can contribute to gastrointestinal problems. So, for example, Mast Cell Activation Syndrome can present with abdominal pain, gas, bloating, diarrhea, if the mast cells in the GI tract are releasing all of their inflammatory molecules into the tissues of the GI tract. If someone is living with dysautonomia or problems with the autonomic nervous system, this will also seriously impact the gastrointestinal tract because the autonomic nervous system plays a very important role in the motility of the GI tract. And finally, if a person has a tethered cord, this is compression of the lower part of the spine, that can impact the motility of the GI tract as well, because the nerves that go to the colon in the lower part of the spine can be compromised in a person who has a tethered cord, and that may cause very serious constipation and is something that should definitely be considered if the other signs and symptoms of a tethered cord are present. There are also neurologic issues that can contribute to GI symptoms. So if a person has craniocervical instability or instability at C12, the top vertebrae of the cervical spine, or if there is a Chiari malformation, the nerves that control the motility of the gastrointestinal tract can be impacted by this instability or the Chiari malformation, and that can definitely cause issues like nausea, like gastroparesis, and lower GI motility issues as well. So these neurologic issues can have a profound effect on gastrointestinal function. So as you can see, there are numerous issues in the gastrointestinal tract that can arise in people living with EDS and HSD. It's very important to determine what the cause of the GI symptoms is in a particular person so that the appropriate treatment can be offered. It's just been a quick review. If you're interested in more information about mast cell activation or dysautonomia or the neurologic issues related to EDS and HSD, please take a look at the YouTube videos on my channel related to those subjects. Thanks so much for spending this time with me today, and I wish you the very best on your journey.